What is the laboratory diagnosis of iron deficiency anemia? We have three things. What we have? Blood examination, bone marrow finding, and biochemical. In blood we have to see all the things. Okay, we have see all the things. Hemoglobin concentration will fall in all type of anemia, so here also HP fall. Then RBC shows hypochromic microcytic anisocytosis, phagocytosis, target cell ring or Fezeri cells. Center pallar occupies. Okay, center pallar occupy whole cell. So this one is the normal cell. This one is microcystic hypochromic red cells. Normal cell HP present in periphery 2/3. Okay, central 1/3 only empty. But here RBC in iron deficiency anemia, first thing smaller in size and comparing to normal. Second thing color is less. Color only present that rim means that peripheral region only. So pallar area increased. Here pallar area increased. Here pallar 1/3. Here okay. Here more than 1/3. Here color is less. That is why it is known as hypochromic red cell. Size also less, color also less and comparing to normal. Second, all the RBC smaller in peripheral blood smear. When we will do peripheral blood smear, all the RBC smaller. After that, different size of cells. Some cells are smaller, some cells are normal. This is known as anisocytosis. Then shape also different. Some are tear shaped, some are circular. So this one name is called as phagocytosis. So anisocytosis, phagocytosis along with targeted cells. Then reticulocytes count normal but maybe slightly low. Then indices MCV, MCH, MCHC, all three indices less. Then leukocytes, total leukocytes count, differential leukocytes count and platelet are normal. Second, bone marrow finding. There is increased erythroid hyperplasia, MC ratio also decreased. Increased erythroid hyperplasia and ME ratio, myeloid erythroid ratio decrease. Erythropoiesis, micronormoblast are there and cytoplasmic maturation. Cytoplasmic maturation lacks behind nuclear maturation. Cytoplasmic maturation lacks behind nuclear maturation. So do the iron stain. That iron stain name is called Brucian blue staining. Brucian blue staining. Also deficient. The iron is less. This one is the normal normoblast, normal human normoblast presented in bone marrow. See this one, microblast. Here iron deficiency anemia patient. Okay, so this is the this type of blast is known as microblast. Then this one is Brucian staining. See here, this one is the normal person, this one is the iron deficiency. here so many blue dot is presented. The blue dot is iron storage. So this one is drastically reduced. Here that blue dot reduced. Next, coming to biochemical, storage of iron also decrease. Storage of iron, that serum ferritin level is decreased. This one is specific and sensitive marker. See the diagram. So this diagram, that black color, this black color, these are transporter. One transporter, it will take two, it will attach to two molecules of iron molecules. So this blue color one, iron molecules, these are the things transporter. Just support in human blood, we talk about percentage. We have 100 transporter. These are the transporter. Okay, transporter of iron. Out of 100, at the time only 33 are saturated. 66 are empty. That is, saturated one is known as transferrin. Saturated one name is called as transferrin. Saturated and empty one is known as saturated and empty. Here no iron, that blue color is not presented. This one name is called as TIPC, total iron binding capacity. Okay, so TIPC is empty one, the total iron binding capacity. So this one name is called as TIPC because they are empty. This one indicating saturation. So we have having two things with us. The filled one are known as transferrin saturation. Okay, filled one name is called as transferrin saturation. Empty one is known as total iron binding capacity. So that iron deficiency anemia, what will happen? The filled one will reduced and empty one will increasing. Iron deficiency anemia, filled one reduced and empty one is increasing. That's why transferrin saturation, filled one is low. Transferrin saturation, this one is low. This TIPC will increased. Okay, increased. So iron deficiency anemia, this what is this one? Total iron binding protein will increase. So differential diagnosis: microcystic hypochromatic anemia, anemia of chronic diseases, thalassemia, sideroblastic anemia. So summary of laboratory diagnosis: blood HP level decreasing, RBC level increase, reticulocytes increase, MCV, MCH, MCHZ, all the indices decrease, WBC and platelet normal, cellularity increase, erythropoiesis increase, marrow iron, bone marrow iron decrease, serum iron level, serum ferritin level decrease, total iron binding capacity increase, transferrin saturation decrease. This is overall laboratory diagnosis summary. Next, treatment. What is the treatment of iron deficiency anemia? Two essential principles. First, treat the causes. First we want to treat causes and then correct of iron deficiency. So causes we want to treat, then correct that iron deficiency. For correction, two type of therapy is available. One is oral, second one is parenteral therapy, intravenous. Okay, so in this oral, usually oral is prepared tablet form. Most common is this ferrous sulfate, ferrous fumarate, ferrous gluconate we are using, but most common tablet form we are using for iron deficiency anemia, this ferrous sulfate. Then parenteral therapy, directly given iron intravenous. we are giving it directly intravenous, but we do not give it usually. There are sudden indication. What are the indication? When the patient cannot take the oral, when the patient have malabsorption, the patient cannot absorb post operative cases, or if you want a replenish rapid refreshment in case of emergency. Here only one preparation is iron dextran. So iron dextran for intravenous only. Iron dextran is available for oral 3 preparation. Therefore intravenous only one preparation. That one is iron dextran. So oral 3 preparation. This intravenous only one preparation, iron dextran. Response to therapy: as soon as you will give the therapy either oral or intravenous, the first thing happen is increase in reticulocytes. So reticulocytes go on increasing. It is showing that the patient is responding to the therapy. So that is all about iron deficiency anemia. So in this video discussed a laboratory diagnosis of iron deficiency anemia. 3 things we have taken: blood, bone marrow and a biochemical test. Then finally end with that treatment for iron deficiency anemia, oral and intravenous. Then response to therapy: first, improve reticulocytes. Thanks for watching.